Hello everyone, welcome to the channel. This is Clinical Reasoning Series, the only YouTube channel providing case-based discussion of clinical scenarios for medical PG aspirants. Today I am going to discuss case number 7. Before I start the discussion, please note that this discussion is only for academic purposes and cannot be directly related to the patient care. I am going to present the brief clinical scenario, the complete scenario of which is available in our Telegram group, which is shared in the link in the below description. So the scenario is like a 72-year-old female who is unresponsive at home. Okay, she has bought the emergency room that she is unresponsive at home. The caretakers generally say that the patient was not well for the past 3 days. It has been mentioned that the patient was not eating well, she has loss of appetite, and also she was lethargic. And the notable history is that she recently completed radioiodine treatment. Past medical history of hypertension and congestive cardiac failure is also present. The first impression which you are getting from this case is that you are dealing with a sick patient. You are dealing with a very emergency. Okay, you are dealing with an emergency sick patient, and she has recently completed a radioiodine treatment. This is actually the clue in this particular question. It's an old age female, so you can expect that maybe a history of hypertension is present, and one more history is in history of congestive cardiac failure also. You can see the examination findings now. It is very clearly written. The temperature is 35. This is very low temperature, is it not? The patient is in hypothermia. The patient is in hypothermia. Blood pressure is also low. We can see that it is 90 by 60 millimeters of mercury. Heart rate is also low. Bradycardia, it is 58 per minute. Respiratory rate is also on the lower side, which is only 11 per minute. Random glucose almost okay, 70 milligram per deciliter. These are the vitals, okay, which you check for when the patient comes as an emergency. Okay, right. Now this patient, because she was unresponsive, she was intubated and was sent to the ICU. The question is, what is the next step in the management of this patient? Is it CT head, IV T3, T4 and hydrocortisone administration, TSH level estimation, or transcranial Doppler ultrasound? One thing to be noted here is that you can rule out the first option, that is a CT head and transcranial Doppler ultrasound, because we are not dealing with some problem inside the brain. Okay, it may be something like a hemorrhage which can cause this type of emergency, but then it is not hemorrhage. It's not hemorrhage. It is something else. The clue for which is already given in your question. What is that? The patient had recently completed radioiodine treatment. That's what I was saying. It is a clue in the question. So what is this condition? A patient was recently being treated. The general condition where we give radioiodine treatment is something like hyperthyroidism or for something like thyroid cancer. Okay. And what happens is when the patient has completed this treatment, it is sort of like you are actually destroying the thyroid to an extent that it can cause hypothyroidism also. So this patient, after completing the radioiodine treatment, should have ideally been started on the levothyroxine treatment, the history of which is not given in the question, meaning that she was not put on any thyroxine supplements, so she might have gone into hypothyroidism. Now with this in mind, if the patient has become unresponsive, okay, a patient who is probably hypothyroid and not treated and became unresponsive at home with very severe hypothermia and hypotension and bradycardia, what will you think of? Yes, what will you think of? Yes, you got the diagnosis correct. It is a case of myxedema coma. Remember, it's one of the very dangerous problems encountered in a patient who is previously unthyroid, who is previously not diagnosed with hypothyroidism or treated with hypothyroidism but with inadequate dosages of thyroxine. Are able to follow? In this particular patient, what could be the factor which might have led to this myxedema? She might have undergone this radioiodine treatment, so she might have become hypothyroid, which was not treated in this particular patient. Remember, this is a dangerous condition that it causes 20 to 40% mortality. 20 to 40% mortality. Even with treatment, this mortality rates are 20 to 40%. So that's why it's a very dangerous condition. Generally, it occurs in the elderly patient, like what is given in our question. And please note that mortality is independent of T4 and TSH levels. Independent of T4 and TSH level. Please make a note of it. Okay. So that is why estimation of this hormones at this present time, estimation of T4 and TSH at this present time will not make any sense because they are not going to determine the severity. Okay, mortality is going to be there independent of T4 and TSH level. So that is why these patients, we should not wait for the lab reports to come. Instead, we have to think about this condition and start treatment immediately. So what will be the answer for this particular question? What will be the answer? The obvious answer for this particular question is option B, which is intravenous administration of T3, T4 and hydrocortisone. I will explain that in the management part. TSH level estimation will not have any value at this time. Okay, right. Talking about the features of myxedema coma, generally it occurs in elderly patient and usually manifests as decreased consciousness or unconsciousness as we encounter in this patient. It can also be associated with seizures and all signs of hypothyroidism, okay, like hypertension, bradycardia, all those things will be present in this particular patient also. Okay, right. So in addition to features of hypothyroidism, it presents as an emergency in the form of decreased consciousness or unresponsiveness. Okay, right. So some of the risk factors, okay, which lead to this myxedema coma are drugs, especially the drugs which impair the respiration of the patient. For example, something like sedative agents or antidepressants can be associated as precipitating factors. Other common precipitating factors include congestive cardiac failure, second is myocardial infarction, third would be gastrointestinal bleeding. These are the probable risk factors which can trigger an episode of myxedema coma. Talking about the treatment, it is something like a severe form of hypothyroidism. So on an emergency basis, the thyroid hormones have to be replaced. So that is why T4 will always be a part of the management. Okay, because this is an emergency, ideally it is given by intravenous route, T4. Okay, however, if the intravenous line could not be secured, you can also give it through nasogastric tube. However, IV is always preferred. Now, why is T3 preferred? Why is T3 preferred? T3 is preferred or T3 is included in the treatment because in this condition of myxedema coma, generally there is impaired conversion of T4 to T3, which usually occurs in the periphery. You all know that T3 is a metabolically most important thyroid hormone. So you need T3 for the body to recover. So that is why you are also giving T3 because there is an impaired conversion of T4 to T3 in the periphery. Okay, so this is not happening properly. So that's why you are also including T3 in the treatment. But please make a note of this. If you give excess of T3 in the treatment, it can actually trigger arrhythmias. So that also has to be taken care of. Should not be given in high doses. Now, why hydrocortisone has to be given in the treatment? T4 and T3 is okay because they are thyroid hormone. Then why hydrocortisone? Remember, patients with this myxedema coma usually have impaired adrenal reserve. Are able to follow this? So, when the adrenal reserve is very less, then the steroid hormone production also is going to be less. So, that is why you always add hydrocortisone to the treatment. So, that is the thing. So, please note T4, T3 as well as hydrocortisone should be included in the treatment. Okay, right. Now one more thing is these patients can have hypothermia to dangerously very low levels. In that case, external warming is also recommended. Remember that external warming is recommended only if the temperature goes to less than 30 degree centigrade. Please remember, not in all cases, only if the temperature is going to less than 30 degrees centigrades. Okay, right. And in case of dangerously low temperatures, you can also use this one. What is this? Which I have just put as an arrow mark. This is called as a space blanket. Sometimes they can ask you in the question. This is for very low levels of temperature. You can use this space blanket. So this is in essence treatment of myxedema coma, which is an emergency situation. One more emergency which you can encounter in thyroid disorders is something which occurs on the other side, that is in the hyperthyroidism. Can anybody tell me that? What is that? It is called as hyperthyroid crisis or thyrotoxic crisis or also called as a thyroid storm. Okay, right. It is a condition where the features of hypothyroidism present in a more severe variety. For example, a patient with hypothyroidism is undergoing stress or infection, something like that. This can actually cause exacerbation. Okay, so the correct word to be remembered is exacerbation of features of hypothyroidism. exacerbation of hyperthyroidism features is what we call it as a thyroid storm or thyroid crisis. So obviously, if I ask you in the treatment, you will be prompted to say that I have to decrease the levels of thyroid hormone. So what is the anti-thyroid drug of choice in case of this thyroid crisis, which is a very important question. What is the drug of choice for anti-thyroid drug of choice in this thyroid stroma crisis? It is propyl thiouracil. Make a note of it, propyl thiouracil. Please remember that one of the very important advantage of propyl thiouracil over the other anti-thyroid drug, namely the methimazole, is that propyl thiouracil also cause inhibition of peripheral conversion of T4 to T3. So thereby it decreases the levels of T3 inside the body. This is actually very beneficial because T3 is supposed to be the metabolically active form of thyroid hormone, is it not? So that is why, because of the additional effect, propyl thiouracil is the anti-thyroid drug of choice in thyrotoxic crisis. The other drug which you have to include is inorganic iodine. It is inorganic iodine. Now this inorganic iodine, how is it going to help? It is by means of Wolff-Chaikoff effect. Is it not? It is by means of Wolff-Chaikoff effect, which you might have read about. And the forms of inorganic iodine which you are going to use in case of thyroid storm are: number one, it could be saturated solution of potassium iodide, or you can use Lugol's iodine. These are the options available during thyroid storm or crisis. Right. Now, these patients also have impaired adrenal reserve. Similar to myxedema coma, thyroid crisis also associated with exacerbation of an adrenal insufficiency or impaired adrenal reserve. So here also you have to give IV dexamethasone. Here also you have to give IV dexamethasone. One more very important group of drugs is that, now you might have heard about the classical features of this hyperthyroidism like tachycardia, hypertension and all. These are all due to what? These are all due to adrenergic enhancement or adrenergic stimulation. So to block this adrenergic effect, you are going to use beta blockers. One of the most preferred beta blockers is propranolol, because propranolol also has got additional effect in high doses of impairing the conversion of T4 to T3. So that is why the preferred beta blocker of choice in thyroid storm happens to be propranolol. Are you able to follow? So please remember the thyroid storm and the treatment options for thyroid storm. So that completes the discussion today. I'll see you in another clinical reasoning series shortly. Hope you have liked this video. Please feel free to share with your friends, and don't forget to subscribe to this channel and press the bell icon so that you get notified of the new videos which are posted to this channel. Thank you and have a good day.